Hartmann Program.
And welcome back. Thom Hartmann here with you welcome back to the second hour of our program. We have had, the president's Obamacare, the Affordable Care Act, all this sort of thing. People, as he was giving his speech this morning, he was talking about how on Tuesday people are going to be able to sign up for the exchanges. The prices are out in a lot of the states. The information is out there. Yet still, a lot of people are confused about this. Exactly what is it? What's in it? Personally, I don't think the White House has done a particularly spectacular job of messaging it. But there are some folks who really have been paying attention and really have become experts on this. Igor Volsky is one of them. He is the managing editor for the Center for American Progress's blog, thinkprogress.org, and he's the co-author of the book Howard Dean's Prescription for Real Healthcare Reform. And Igor is going to stay with us for the full 45 minutes right through till to our newscast, or 50 minutes, until our talk radio news at 10 minutes before the hour. So, Igor, welcome back to the program. You've been on our program before.
Thank you. Happy to be back.
It is great to have you. And I just want to let people know that you're perfectly willing to take questions. So if you have questions about Obamacare, and I have a few I'm going to start off with, but if you have questions, if you're on the line with other things to talk about, our call screener is going to come on and ask you to drop off to open up the lines for people with Obamacare questions. If you have questions about Obamacare, just give us a call, and Igor will do his very best to answer them. So the first question that I had for you, Igor, is, we run a small business here, and this program, and between our radio show and our TV show, I think we have, about 10 or 12 full-time employees and a couple of part-time employees, and we give everybody health insurance. We have forever. I mean, every business that Louise and I have ever owned, we've given everybody health insurance. And we're trying to figure out if our health insurance is as good as, better than, or worse than the best of the Obamacare plans. And should we do as some other businesses have and let our give our employees the money so that they can buy it themselves, or should we do it? But we haven't been able to find the details of the plans, and it seems like it's going to vary. Being here in D.C., we've got employees who live in Virginia, employees who live in Maryland, and employees who live in D.C., and as well as actually a couple of other states. Our webmaster, for example, is in Tennessee. So what do we do?
Well, Tom, the good news is that on average, what you're probably offering your employees, and by the way, good for you for offering that coverage.
We're offering a pretty top-of-the-line program from Aetna Blue Cross. It pretty much covers absolutely everything.
Yeah. Well, I would imagine the way it's going to work in the exchanges is you're going to have different tiers of coverage. And so if you want a little less coverage and to pay less premiums, you would have to choose the cheaper option. The top level, the so-called platinum plan, I would imagine is probably comparable to what you are offering your workers now. And the good news is that come next Tuesday, you're going to be able to compare and see. And it's really the first time that you are going to compare really apples to apples, because before there was so much fine print in all these policies, it was hard to tell what's what. Now they've really standardized this thing with Obamacare on the website, and you can really tell what you're getting and decide then if you want to switch. So it's going to be up to you, and you're going to be able to figure it all out in a really, for the first time, a pretty clear and transparent way.
If any of our employees were to say, the health insurance plan that you pay for us, you give us, is all well and good, but I would really like to just get my own health insurance plan. Maybe this person might be thinking about, moving on to another job, or maybe they want to go part-time, or they just want to have control of their own health insurance plan, or whatever. There's a whole lot of different reasons why an individual might want to do that. And this isn't, I'm asking this in the context of my business, but it's also an abstract question. I think, it's people, all employees are probably wondering. Right now, as a corporation, as a small, we're a sub-S corporation, but we're incorporated as a small business. We can deduct the cost of our employees' health insurance from any money that the show makes to, it's kind of subsidized by the IRS in a certain way. It's a tax-deductible expense. If one of my employees comes to me and says, take me off the company policy, I'm going to buy the Maryland, platinum plan myself, and by the way, it's going to cost me, $300 a month. Would you please give me the $300 a month? Does that become then a taxable event for them? Are they getting a pay raise, and so their personal income taxes are going up? B, is that, or is there a way for me to do that we can simply designate that as health insurance money, and is it tax deductible to us as a company? I mean, how does that work?
Well, there are two different exchanges that will open starting October 1st. One is this individual exchange that we've heard so much about, and that's where if somebody wants to move on from the Thom Hartmann Program and they need health care, they'll go to that exchange and they'll compare policies and sign up and see if they're eligible for tax credits and go on from there. Mm-hmm. Second exchange is the so-called shop exchange, and that's the exchange specifically designed for small businesses, for businesses up to about 100 employees. And states have some leeway in playing with that number, so it's going to depend on what the regulation in your particular state is. But the shop exchange is designed for this very purpose, so that you, as a small business, can enter the shop exchange, and you're going to have insurers offering policies, and you can take your employees with you. And in that exchange, it's going to work just like the other exchange, where you'll be able to see if they are eligible for any kind of help. The deductibility, though, doesn't continue. So while employer coverage, as you pointed out, is heavily subsidized by the government, it's one of the biggest deductions in the tax code. You hear a lot from conservatives that, we can't have government in our health care and government takeover. Well, the truth is the same folks who are saying that have this kind of big tax subsidy through the tax code. But Obamacare doesn't extend that same deduction. It does offer subsidies.
That's interesting. So as a business, if we go into the business exchange, we can no longer deduct the cost of the health insurance, but we do get a subsidy. Is the subsidy based on
as a business? I believe it's that as a business you can continue deducting the coverage.
Okay.
As an individual, though, I think that's where it changes, because the point is you can't get the deduction on both ends, both in terms of the tax code and then the subsidy.
Right. Okay. And is it possible for some employees to stay on a non-Obamacare program and others to say, I'm just going to go with the Obamacare plan?
That's one of those glitches that you keep hearing about. The design of the law intended for that to be possible from day one. They're running into some technological difficulties in figuring that out, and I think that option is going to be available next year, that kind of split that you're talking about.
Right. Okay. So for the moment, then, basically, if you work for a company and you're getting health insurance, and that company chooses to continue offering that health insurance from that provider, whatever it may be, in all probability, your best bet is to just stay with that for the time being.
Yes. And you are, as an employee of that company, are going to have that one choice that the company, if they take you into the exchange, has selected.
Right. And if you bail out of that, you can buy private health insurance for yourself on the private exchange, but it's on your own nickel and it's not deductible.
Yes.
And if the employer wanted to compensate the employee, that would be considered compensation. So if an employee needed, say, $300 a month to buy it on the exchange, you'd probably have to actually give them like $400 a month to cover their taxes, right?
Yes.
Okay, so that makes a lot of sense, and I understand how this works. We've got a bunch of callers with questions for you. We're talking with Igor Volsky. He is the managing editor over at the Center for America's Think Progress blog, the author of Howard Dean's Prescription for Real Healthcare Reform, and an expert on Obamacare. He's taking your calls and questions right after this break. It's 15 minutes past the hour. Be sure and check out Igor's blog over at thinkprogress.org. We'll be right back.